Hi guys, welcome back to another video of Educate channel. So today we will be discussing about veterinary surgery and radiology section, that is affections of male reproductive system, and we will be discussing about affections of testicles. So first of all, absence of testicle, that is anorchid condition, presence of one testicle only, that is monorchid, failure of descent of testis, that is cryptorchidism, abnormal location of testis, that is ectopic testis. So we have been very familiar with this term, that is ectopic pregnancy in case of female reproductive system. So we will be discussing about first one is the cryptorchidism. So failure of descent of one or both testis into the scrotum is called as cryptorchidism. So the most common congenital anomaly, that is actually the hereditary condition, congenital anomaly. So left cryptorchidism is very common in case of cattle, and right cryptorchidism is very common in case of goats. So the testicles are to be in the scrotal sac, are meant to be in the scrotal sac because they need much less body temperature than the body temperature inside the animal body. So due to these temperature problems, they become sterile. So the cryptorchids are sterile. The treatment in case of this cryptorchidism is actually flank ciliotomy, cryptorchid testis should be removal, and paraprepucial abdominal incision can also be practiced. So the affected testis is to be removed. So the consequences of cryptorchidism is actually spermatic cord torsion, testicular neoplasia, etc. So whenever we come in contact with any of the cryptorchid cases, we should refer for castration or the removal of the testis, affected testis. Next is the testicular tumors. So that is very common in older uncastrated dogs. Very much common in case of older uncastrated dogs, and this mostly appears in older age dogs. So very common is actually seminoma. Seminoma means the tumor of the germinal epithelial cells. Sertoli cell tumor, that is the Sertoli cell tumor. Interstitial cell tumor, that is actually the Leydig cell tumor. So whenever there is Sertoli cell tumor, there will be excess of production of hormones, estrogens and all. So that will lead to the feminization, and interstitial cell tumor will lead to hyperandrogenism. So the clinical signs will be mainly swelling, pain, systemic illness, absence of any sexual arousal, etc. The treatment is actually surgical removal of the testis or both of the testis as a prevention and control method. So next is the hydrocele, that is accumulation of fluid between the layers of tunica vaginalis. So it can be unilateral or bilateral. So once it's unilateral, it will be going to the bilateral condition. So the etiology can be trauma, faulty castration, infection, wound, brucellosis, etc. So the clinical signs will be soft, non-inflammatory, fluctuating swelling. The treatment is actually exploratory puncture. So we'll be getting amber colored fluid, and castration or orchiectomy is the best treatment method to be adopted. So the next one is scrotal wounds. So that can be actually due to trauma, bite, swollen, and it will be very painful and profuse hemorrhage will be there. And this depends upon the condition of the wound. So the treatment is actually we have to completely prevent the myiasis, and antibiotics, NSAIDs, and wound healers should be given. So castration or orchiectomy in case of severe case of wound. So what is actually the total scrotum ablation? So this is actually a very important term whenever we are going to study about the affections of testis. So the surgical removal of testis and scrotum under general anesthesia, and closure of the inguinal canal, and tying up of muscles and ligature of the testicular artery, and proper removal of the scrotum along with the testis. So thank you.